Hello, everyone. Welcome to our presentation on the COVID-19 Boston Memorial proposal. Our thesis is this. As Boston was one of the epicenters of the COVID-19 pandemic in the United States Northeast region, the 1,404 Bostonians who lost their lives and those who made efforts to stop the virus from spreading, we believe must be honored with a memorial. And we'll get into the form of that later. But first, we shall give you some context.
Yep. As Khalil previously mentioned, the context is very important because as we all know, COVID-19 has had a tremendous impact on all of our lives, and especially that of Boston's. So here is a brief timeline of COVID-19 in Boston. On February 1st, 2020, the first confirmed case was recorded. A man from Wuhan, China, came to Boston and he had symptoms. He was not hospitalized, but he was able to recover on his own. March 10th, Governor Charlie Baker, he declared a state emergency. On May 28, 2020, the Boston Marathon, the Pride of Boston, was canceled for the first time in 124 years, and it marked the destruction of culture that was experienced throughout the world, and especially Boston. And in June 11th, 2020, a big event happened where in Cambridge, a biotech company called Moderna developed a vaccine that was ready to be tested. And obviously, we've seen that it has been administered nationwide. The timeline of Boston does give us a lot of context to the effects that COVID-19 has had, but it does not show us the tremendous impact as much as these numbers do. The total number of cases in Boston was 75,214, and the total number of deaths in Boston was 1,404. It really does show that we must commemorate the effects that COVID-19 has had on the city.
So another important thing to consider when considering COVID-19 as a whole is the demographics of it. So on the surface, you might be thinking, what does this really have to do with a pandemic and something that seems so apolitical? But really, when you take a deeper look at some of the statistics, especially in such a diverse city like Boston, you would see that one of the most affected neighborhoods in Boston was the neighborhood of Dorchester. And while Boston is 53% white and 25% Black, Dorchester is only 29% white and 36% Black. You can really look at this as being caused by a number of factors. Some inequity in healthcare definitely might be playing a role here. And it's really an interesting thing to look at when you look at some of the deeper effects of this pandemic. Another important statistic to look at is the age of most positive tests. A lot of times we think of COVID as being something that really only affects old people. And that was sort of true earlier in the pandemic and in 2020. But with the Delta variant and its more contagious and more dangerous nature, actually the most common age range of positive tests in Boston is now 20 to 29.
So just to start off, while we just gave our background, we're going to give our examples of some memorials that we've learned from during this residency and how that impacted how our memorial was going to be shaped. So the first one was the Emancipation Memorial. It's a memorial depicting President Abraham Lincoln, which was built after his assassination in 1865. And it represents his status as the great emancipator. It was built by many white people, although it was funded by freed Black slaves because they wanted to, again, honor his memory and kind of give thanks to him. It was placed in Washington, D.C. in Lincoln's Park, but a replica was placed in Boston's Lincoln Square. As I believe I said before, the statue depicts Lincoln bestowing freedom upon this Black slave. The slave, as it probably can be seen, but maybe not as clearly, has broken free from their chains. And although it does seem very great despite its best intentions, it has many problematic elements based off of how the slave is depicted in contrast to President Lincoln. Ultimately, it contradicts its design because it makes the slave seem lesser than President Lincoln, which doesn't seem like the kind of intention that the funders wanted it to have. And this continued on for about a century and a half to come into the present day, with lots of controversy about this statue until it was removed in December of last year. And we believe this is a good memorial to have looked at because it just reminds us to always include the possible perspectives that can come from a memorial, as not including them can really make certain groups of people feel offended by how things on it are portrayed.
Another example of a memorial we don't want to incorporate in our project is the Christopher Columbus statue in Boston, which was installed in 1979 in the North End. The controversy came in the late 2000s when more awareness about the realities of Columbus's practices were brought to light, and the statue was repeatedly vandalized. Because of that, many began to realize that the myth of Columbus discovering America created the foundation for the erasure of indigenous people. This resulted in the statue being decapitated in 2020. And because of that, experts decided to remove it and install a new memorial honoring Italian immigrants, as the North End neighborhood has a large Italian immigrant population. However, experts such as Martin Blatt, the director of the public history program at Northeastern, believed that the consideration for the new monument should have been given to honoring the indigenous people who were killed at Deer Park, which is viewable from Columbus Park. And from this, we sort of learned that the memorial serves as a reminder to consider various populations which may be impacted by the installation of a memorial.
The AIDS quilt is a memorial that we looked at when looking at how a monument can honor an ongoing medical crisis. It was organized by gay rights activist Cleve Jones in 1987 and displayed in the National Mall in DC. Previously, there had been an annual candlelight march, which was held in San Francisco to honor those who had lost their lives to AIDS. However, activists wanted to create a nationwide impact. This inspired us when looking at our own monument, as we wanted to make sure that the stories of Boston could be accessible. People were able to send in panels, which were added to a growing quilt that included over 40,000 panels. This inspired us because we wanted there to be a community aspect in memorializing people, and we wanted people to be able to choose how they wanted to represent their loved ones by being able to upload their own memorials to our memorialette, which would be displayed virtually. The AIDS quilt went on a 4-month, 20 citywide tour, which raised $500,000 for various AIDS organizations. And this was something we referenced when building our own monument because we wanted to include something that could help the pandemic going on right now. So we would have information on nearby vaccine and testing centers, which would be available on our memorialette.
So we thought it was another good idea to include the Boston Marathon bombing because the Boston Marathon was a very important annual thing in Boston. So the bombing happened on April 15, 2013. They decided to build 4 crosses that were built to honor those who passed and those who were injured. The public was able to add messages and personal objects to those crosses, and later they were preserved because they're very important. It was successful because it allowed everyone in Boston to grieve. Messages, cards, and drawings were made into the picture that you see below. And it's called Our Marathon, that could be found anywhere online. And it was hosted by Northeastern.
And finally, and probably the most interestingly, is a COVID-19 memorial that was built last year in September, the fall of 2020. It was built to memorialize the 250,000 people who had lost their lives. So yes, as you're probably thinking, every single flag was representing a death of a person, and people could add their own messages to make it more personalized. So there was lots of community involvement. Eventually it was dismantled, but was planned to move online so it could reach a wider scope of people, and it can really relate back to our memorial because that is going to include both a physical and virtual aspect, as we will explain in the next slide.
And yes, like Khalil mentioned, we will have an interesting memorial design where we'll have physical and virtual aspects. And the center of it all is a memorialette. And I know it's not a real word, but that's what we came up with, because it's basically a tiny memorial, a mini memorial that we will place around the city. And you will see that in the following slides. The structure of the memorialette is quite simple. It's just a screen with information and any other information pertaining to loved ones and any heroes that we want to memorialize and remember. And there's also a QR code that takes the user to a website. At that website, the users can post anything about people who died to COVID, or anything they find interesting about the efforts that people have made to combat COVID. So it's really open to all, and it's a community-driven memorial. And we will discuss the locations of these memorials because they are important to how they function. So you can visit our memorial using this link, but we will show you this anyways right now. It's on Google Earth, and I hope you find it interesting.
But to start, we will go to Boston Common.
We chose not to include a memorial at Boston Common, as the area already has many historical monuments, specifically one to the 54th Regiment, and we wanted to place monuments in areas which were more impacted by COVID and have a direct relation to it.
So this is City Hall. We would place the memorialette over here because there were many public servants who helped Boston by deciding protocols in the COVID pandemic.
And our next location for a memorialette would be MGH, or Massachusetts General Hospital. Frontline workers and doctors have been essential in fighting this pandemic. And in order to honor those who have both helped and given their lives for this effort, we think that this area would be perfect and fitting to honor anyone who has helped to keep everyone's safety. This is one of the most prominent hospitals in Boston, and it is quite easy to get around. So it fits our COVID trail pretty well.
Chose to put one at the financial district because we felt that this would represent the economic effect that COVID-19 had on Boston, as this is an area which is full of top-end businesses and investment companies.
Moving on to the district next to it, we have Downtown Crossing, just on one of the edges of Boston Common. And while it is also an economic hub, it is also pretty active and busy. It's also very populated. So this can really take into effect how population in Boston affected how long the pandemic went on and how much it spread across the city.
And then our last location is the Northeastern University Quad. We would put a memorial here because, as many of you know, COVID had a tremendous effect on education, and it will represent the lives of students and professors and teachers during the pandemic.
This was just a small sample. Again, it was a proposal. If we were to actually do this, presented in front of maybe City Hall or someone else, this is what we would most likely present if we had more time. We would try to get more diverse perspectives like we were talking about earlier, so we could have more insight onto how the memorial might have to be changed, or if there needs to be more added to it or not, or if placement is different, especially since we were thinking about placing it in more neighborhoods around Boston, since of course it didn't just affect that small area that we were talking about before. We would also like to figure out how it could work online, how people could add it, what sort of regulations might need to go on there. And as for regulations for physically placing it, we would have to talk to the city and also people who have aptitude in like technology and just construction in general to figure out how it would be placed.